there,
Get on up.
everybody right there,
Get into it.
everybody right there,
Get involved.
everybody just come on up, come on up.
LSED is Legal Services for the Elderly, Disabled, and Disadvantaged of Western New York. Our website is www.lsed.org. We are a nonprofit legal services organization, and we provide free legal services and advice to a variety of people throughout Western New York. We provide advice to multiple counties, and we represent people in various legal issues. We work a lot in healthcare law, which can be anything from helping people with Medicaid applications or claim denials by Medicaid, Medicare, or private insurance, helping people leave the nursing home. We offer people all kinds of consumer protection, a lot of identity theft, or helping people who are scammed, any people who have landlord-tenant issues, all kinds of things with mortgages and foreclosures. There's a lot of issues that we work with. Yeah, of course. Avoiding a nursing home or an emergency room bill is very, very important. One of the first things you can do is, I always say, to really, if you can, assess whether or not you need to go to the emergency room. I know, myself included, a lot of people automatically think emergency room if you're sick or if something goes wrong. But a lot of times these things can be addressed at your general practitioners or at an urgent care facility, most of which are open 24 hours a day. They're much cheaper. A lot of times, unfortunately, ambulance transportation will end up not being covered by your insurance or by Medicare. There's a real high threshold for that, and basically they say, they ask if it was medically necessary for you to truly be transported by ambulance, which usually means, was there something that had to be done to you, for you, by someone in that ambulance? And they also ask if you could have gotten to the hospital in another way. So if you had the option of taking a cab or getting a ride from a family member, most of the time your ambulance is not going to be covered. Always look at what you're signing. I know it's a really stressful time, it's very confusing, absolutely, but look at what you're signing and read it and see what it says, because a lot of times included in all that paperwork is a notice that might be telling you that your insurance, your Medicare especially, isn't going to cover the care that you're getting in the hospital and why they're not going to cover it. There's several reasons. They might say that it could be better addressed in a different facility, such as going to a rehab clinic, or they could simply say that this doesn't reach the type of level that it's medically necessary for you to be in a hospital. And a lot of times they'll say to you, this is how much it will cost you if you stay here. And that's real. You gotta react to that very quickly, which means that if they're telling you you don't need to be there and you can leave, you should leave and you should get the problem addressed elsewhere. If you can't leave right then you can stay, but then you should make all the moves you need to get to a rehab facility or wherever you have to go as quickly as possible, because it might not be covered. I always tell people that if they can, to speak to the admitting doctor. There's a doctor that admits you, and usually that's the person who will decide if you're what they categorize as being inpatient or outpatient. Outpatient care can be given in a hospital while a person is in a hospital bed for a long period of time, actually. Essentially, it just means that the hospital has determined that they don't think that person is there for a level of care that's necessary for them to be in the hospital. A lot of times people who don't have family members that can come pick them up, or they aren't being very proactive about getting out of the hospital and getting into a rehab facility or going home, they're affected by that, because you might think, I'm in a bed, I'm good, I'm an inpatient, when in reality you've been categorized as an outpatient the entire time. It can be difficult, like I said, that if it's an emergency and you are unconscious, or there is a real emergency and you need immediate care, it's very hard to determine if a doctor is in your network. But unfortunately, you can go to a hospital that is in your network and be seen by a doctor that is not in your network. So if you're able to determine what doctors that are working in the ER accept your insurance, or if this doctor does accept your insurance, that's very important, where the services given by the hospital might be covered, services rendered by this doctor might not be covered later on. It's 716-853-3087, that's our intake line. Usually there'll be someone live to answer the phone. If not, leave a message and we call you back right away.
Everybody over there,
involved.
Everybody